Hey guys, Michael Duchynski, the medical director here for Summit Urgent Care and Occupational Medicine. It's that time of year again. We're getting ready to do the Fayette County bus driver physicals for the 2020-2021 school year. And with everything that's going on in the world, this pandemic that's happening, some of you may be a little nervous about coming into a medical facility to get your physical done. And I wanted to let you know the things that we're doing here at Summit to make sure that this year's physicals go off very safely. And so one of the first things we're doing here at Summit to keep you safe is we're separating sick and well. And this is actually something we've been doing probably since March. And so when you come into the building or come up to the building, there's someone available who will screen you and essentially make sure that you're not having any symptoms that could be suggestive of coronavirus. If you do, we're actually seeing those patients outside of the building in a little pod that you'll see in the parking lot, and only allowing people in who don't screen for any of those symptoms actually physically into our clinic. By doing that, we're keeping the inside clinic environment very, very safe and kind of as free from infectious material as possible. The second thing we're going to do is we're going to have separate waiting areas. And so when you come into our clinic in Fayetteville to have this done, there'll be a waiting room on one side where we'll be seeing, we'll seat patients who are coming in to be seen for urgent care. Again, those are only going to be patients who've already been screened out for those symptoms that we worry about. And then there'll be another waiting area where you can sit in, which hopefully you won't be waiting in very long anyway, as we're kind of going to move you through as quickly as possible. We're going to have designated exam rooms. So there's going to be a hallway. It's going to have 4 exam rooms. Those exam rooms are only going to be used for the physicals. So there won't be any urgent care patients going in and out. It's just going to be you and your fellow employees coming in for the physicals that'll be using those specific rooms. You're also going to have dedicated staff, and so we're going to essentially have on those days separate staff that'll be doing all of the physicals themselves, providers-wise, the nursing staff that's going to do your vital signs and do your vision. They're all going to be dedicated to this process, and then there'll be a staff that's on normally that'll take care of the normal urgent care flow. Masks. So we require masks for everybody within the clinic. That means both patients who've screened out of the coronavirus screening and are allowed to come into the clinic will be wearing a surgical mask. All the staff will be wearing a surgical mask, and you'll be given surgical masks too to wear the whole time. Again, just another piece of the puzzle to kind of reduce the possibility of picking up an infection really anywhere, but specifically when you come in for your exam. Finally, as you all know, we've gone through this before, we have a pretty streamlined process. We kind of move you through quickly, and that's both just from an efficiency standpoint. We've always tried to do that, and this year it'll be a benefit because it'll kind of limit the amount of time you're physically in the clinic as well. And so we're going to keep that streamlined process, try to move you through as quickly as we can, so you limit the amount of time you actually spend in the clinic, get your physical done, move on, and really be able to go about your day in the safest way possible. We look forward to seeing you this year and getting these done. A lot of uncertainty about the school year, but one thing we know is we need to get these bus driver physicals done, and so we're going to go ahead and get that started in June, and we'll see you then. Thank you.